Okay, thank you very much. I want to say good morning to everyone. So, when it comes to the using digital platform to take care of patients generally or healthcare issues, I think what I have heard that surprised me the most was the fact that some patients, not even few of them, some of the clients said, "Oh, you mean I will see a doctor without a doctor seeing me physically?" Um, and it took a while before that actually faded away. And till now, when I remember those things, it just makes me to smile because we are in the world of digital platform right now.
Thank,
Thanks.
thank you so much, Dr. Adeniji. That's really insightful. I mean, a lot of people are scared of technology. In fact, people think not going to the hospital, you won't get the best care just speaking to a laptop. So that's fantastic. Dr. Salako, can we hear from you?
Yeah, I would say the funniest thing I've heard, which is weird, coming from, I would say even the medical community, is that digital health will not solve cancer patients' problem. Uh, and that's weird because we're in the 21st century. There's a role for digital health.
All right, fantastic. So, Mr. Biodu, what weird experience have you heard about technology and health in general?
Okay, so maybe not exactly weird. For me, it's more of a fascinating thing. So there's this robotic engineer who actually invented a bra that can detect tumor. It uses ultrasound technology. It's got sensors in it that can, detect whether a tumor is malignant or if it's benign. And then from there, the results can be sent forth for proper treatment. And for me, that's really fascinating because it helps with, knowing on time if you've got a cancer, and then you can, of course, start treatment. For me, it's fascinating.
Yeah, that is really fascinating. I mean, thinking that you could just wear a bra and just get diagnosed if you have breast cancer or not is next level technology. And those are some of the technologies that we want to explore here today. So thank you for that. So we know that the role of technology in expanding access to cancer care is expanding globally. And for us today, we want to know, is Africa prime to adapt some of these last mile cancer technologies to address our peculiar cancer challenges in Africa? Now, Abiodun, your organization, Aspire Coronation Trust Foundation, launched the Changemakers Innovation Challenge in 2020. And this challenge, as we know, it is open to non-profits and social enterprises across Africa who are deliberately using diverse technology and digital tools to solve, to create innovative solutions that address health challenges. So can you share some of your experience in funding health innovations in low and middle income countries?
Okay, thank you very much, Dr. Dora. So Changemakers Innovation Challenge started in 2019. It was born out of the fact that Act Foundation found that there are people, social entrepreneurs or small businesses who are actually doing great things, but then they need a little nudge. They just need a little more help in terms of funding. So these are actually people who are using technology to advance the lives of especially the vulnerable in the society. Talk about women, children. And so the challenge was initiated to support such businesses that usually startups, maybe like 2 years or more, but then they show potential for making meaningful impact. So you have projects that are, for example, using technology to provide blood and blood products, agri-businesses, mobile technology around maternal health and child health. And that has been an awesome experience for us, knowing that you can actually, go digital and you're still solving problems, even in remote areas, because we've gone on to, to implement these in places where naturally people wouldn't have had access to such technologies.
Right, fantastic. I mean, I think a round of applause for ACT Foundation, if you will say. ACT Foundation has been supporting a lot of health initiatives. I know a lot of people who have benefited from some of the grants and funding for technology solutions that ACT Foundation has supported. So, amazing job being done. So, over to you, Dr. Adeniji. I know that one of the pillars of comprehensive cancer care is making an accurate diagnosis. And We know that mCure Healthcare is a leading diagnostic center, which recently set up, the AIDS Cancer Center, and you are the chief medical director of that center. So can you share how mCure is using technology to enable cancer diagnosis and treatment?
Thank you very much for the question. So basically, in the healthcare industry now, we know technology is penetrating everywhere. And that is what everyone in the healthcare, whether professionals or support staff, should be looking at now. For example, we're talking about the best way to make diagnosis. It starts from the fact that you're able to have prompt contact or early contact with the individual, and also you're able to get the sample analyzed and then get the result back to the person without the person moving as much as possible. That's technology. You're just on the online platform doing everything possible. So that's what mCure has explored, and mCure has been doing this for many years. For example, there's something we call the Hello app, where the doctor can make a request, and then the sample gets to the center, diagnostic center, and the result is sent back to the doctor or to the client without you coming in. And interestingly, another thing we also do is when you come for imaging investigations and you want to see the images, you don't have to come in to pick the films. Things have moved. And there is a link that will be shared with your physician or with the client. And at the end of the day, you open the link, you see the images. So the physician can project that on his screen to look at what is going on. And that saves time. It saves a lot of stress. It increases effectiveness, efficiency as much as possible. And recently, would I say recently, early last year, 2022, around January, mCure set up the first cyclotron in the whole of West Africa. And the importance of cyclotron is that it goes beyond the conventional imaging investigations, which will give you some information. But PET-CT, and PET-CT is not possible without cyclotron. And it's also capital intensive. So what it does is that it brings in some radioactive substance to be able to detect the presence of cancer in the body to the best level, if I can use that word, such a way that the accuracy, the precision, they are very high. And that's what mCure is now. So it's part of the Comprehensive Cancer Center that we have built. And that's why we say mCure in the entire West Africa has the most comprehensive cancer center, because nobody does in West Africa. So, and people travel all around the world, even from outside Africa, to take advantage of that. So mCure is exploring, and we are still exploring. We are looking at a few other things which will come up very soon. Thank you.
I mean, that's fantastic work. To know that this level of technology resides in Nigeria and can solve the problem of the African continent, especially for cancer patients. If you know very well, in Africa, Nigeria, though the most populous country, accounts for over 125,000 cancer cases yearly. And close to 70% of these cancer patients would die. So knowing that such technologies exist, I know would decrease, that mortality rate drastically. And thank you, mCure, for the work being done. All right, so to Dr. Matthew. Dr. Matthew, you are based in the University of Leeds in the UK, but you have led a multi-country qualitative study in Africa that has assessed the digital health needs of cancer patients. Can you highlight for us some of your research findings of what an African cancer patient desires when it comes to palliative care?
Yeah, absolutely. Thank you for the question as well. So just for some context, it's estimated that up to sort of 70-80% of cancers, across the Africa region are actually incurable and advanced at the time of detection and diagnosis. And that's due to a range of factors, including late presentation, poor access to prevention treatment facilities, a wide range of different reasons. And the large proportion of people living with advanced cancer in the region are likely to have palliative care needs. So these could include the need to prevent and relieve physical
Fantastic. Thank you so much, Dr. Machi. So, in all of these areas or sectors that you've highlighted, what would you say is one of the areas in some of these resources that are still lagging behind? So I know you talked about telemedicine or digital health solutions. You also talk about some of the palliative care and patient-reported opportunities that lie. So which of these areas are still lagging behind and still require more efforts in supporting patients or people living with cancer?
Yeah, so that's a really good question. I think the research field generally, in terms of translating findings from the context of high-income countries. So, for example, I mentioned Ethan Bash in the US study. There's still, I think, across all applications of digital technology for cancer care in lower resource settings, there's a need to really develop the evidence base across a wide range of applications. So I don't think there's any one particular application or use. I think there's a real opportunity for research and development of all types of digital health approaches. I guess one kind of exciting bit is, and it hasn't been explored today, is prognostic modelling. So using data from clinical systems, from patient records, and combining that with maybe patient-reported outcomes data to understand what the possible trajectory of somebody's illness might be in the future to really inform clinical decision making. It's an exciting area that's being developed in the context of high resource settings. But increasingly, I'm thinking about Lagos and Cancer Centre, the digital data that's being collected there is getting ever more granular detail. There's real opportunities to apply some of those approaches like prognostic modelling as that infrastructure develops.
All right, fantastic. I mean, really exciting technologies that are being developed. Now, to speak more on research, Dr. Salako, we know that Oncology has launched 2 hubs in the College of Medicine, University of Lagos, and the Olabisi Onabanjo University Teaching Hospital in Ogun State. Can you share with us how these hubs are generating, insightful data and clinical services for cancer patients?
Thank you for the question. So the hub in College of Medicine, University of Lagos is more of an academic hub where medical students, nursing students, and anyone in the academic community comes in with their digital health idea. And our goal in the hub is to nurture that idea. And academicians have ideas in digital health, but the curriculum does not enabling environment. When I say enabling environment, I'm talking about investment, resources, manpower dedicated to bringing the idea from dream stage to reality or to a product. So what we do at the hub in the Department of Radiotherapy, College of Medicine, Idiaraba, is these ideas. We nurture them and then bring them to life. But more importantly, just to reiterate what Matthew said earlier, is to provide evidence. For us in the medical community and digital health community, it's important to publish your work, do research to learn new insights. And one of such is the PROS tool. So a lot of cancer patients, when we treat them in the hospitals, they go back home and they have a lot of side effects. And we all know that many hospitals shut down by 4 or 5 p.m. So what does this tool do? It allows you to report your side effects. It is a very simple tool, a web application, where a patient who is at home 7 p.m. or weekend can report their side effects. I'm having diarrhea, I'm having pain, the pain is this serious. It grades it, and at the back end, a healthcare professional is able to see the symptoms, grade the symptoms, and then provide medical advice. In instances where the side effect is serious or severe, for example, a patient having diarrhea 7 times, a cancer patient having diarrhea 7 times is an emergency. Such a patient will be invited into the hospital through the accident and emergency. And that's a tool that we have just piloted in Lagos University Teaching Hospital, We onboarded about 137 cancer patients. They reported more than 40,000 side effects. And so for the first time, we are hearing from our patients, not from the clinic, but from the comfort of their home through this technology. So our goal is, for this type of technology, it is about delivering care to the patient, whether they are right in front of us or they're outside the four walls of the hospital. The hub in Olabisi Onabanjo University Teaching Hospital, it's a small space like this, like this stage, if I may say, but it is kitted up with audiovisual equipment wherein cancer patients can walk into the hub and virtually an oncologist will come into the hub through the audiovisual equipment. And this is so important because in Nigeria, there are less than 90 oncologists in the country. I'm an oncologist, Dr. Adeniji is an oncologist. We are 20 in Lagos State. Lagos State is lucky, if I may say. There are 18 states in Nigeria that do not have an oncologist, but there are thousands of cancer patients. So it's mind-boggling to think, how are cancer patients getting best care when there are absence of cancer specialists across the country? One way we can deliver this cancer care again is through technology, and that's what our virtual hub is doing in Ogun State Teaching Hospital. So I believe those are two.
Amazing work that is being done in being able to connect cancer patients, redistribute the scarce resources, the clinical oncologists, to all those 18 states that do not have a clinical oncologist, and most importantly, being able to, gather and get the patient experience, top notch. So very, very fantastic work. So to my audience, please, there's a Slido link. And we just want to take a quick poll on the Slido link. For us on the poll, we want to know how familiar are you with this topic? So the Slido link is up there for us. So please take the Slido link, and we'll be waiting for your response. We want to know how familiar are you with this topic? So while our polls are going on, please also know you can use the Slido link to ask your questions, and we'll be expecting and we'll talk to those questions really shortly. So I just want to have one more question from my panelists. So I would like to start with you, Dr. Adeniji. Now we know, we've heard some of the insightful work that mHealth is doing in using technology as an enabler for cancer care. Can you share with us maybe one particular pain point of patients that you've encountered that would say these areas are lacking when it comes to supporting cancer patients? One pain point of patients.
Thank you very much. So a quick one, like Dr. Salako said earlier on, that we have few oncologists all over Nigeria. And, sometimes when we say Nigeria is the giant of Africa, many of us don't believe that because we look at things happening in Nigeria. But there are many African countries that don't even have up to 20% of what we have. For example, there are African countries that don't have one oncologist in the entire country. And, I've had the privilege of consulting for one of the top officials in Liberia. They don't have single oncologist. And, because they have the resources, they had to travel to the US, travel around the world to be able to access care. But when I thought about that, I was like, this is ridiculous. Liberia, big country. So, when I see things like that, I know it's lacking, number one, even outside of Nigeria to start with. And then we also have states, like Dr. Salako said, that don't have oncologists within Nigeria. So the support is lacking. A lot of clients or patients, they travel into Lagos, Abuja, and a few other states to be able to, meet oncologists and get the best treatment. But in terms of support for cancer patients, I want to say, number one, there's something we call patient navigation, where someone that counsels the patient or the client and tells him how to go about accessing this care. It's lacking in Nigeria. That one is confirmed. Most of the time, the oncologists will have to double as that to be able to guide the patient. And then another support is the gadget or the medical equipment that we need. For example, radiotherapy. The number is building up in Nigeria now, but it's still very few. A lot of people still travel around, go through the stress of journey to be able to access good one. And I'm not talking about, because when we talk about cancer care and digital, it applies to everything from health record keeping, even to radiotherapy. Now, there is something called digital radiotherapy care where you can, talk to someone outside your center. Someone outside your center can actually contour your patient for you. Or you have a patient and you don't have time. Someone just say, I will contour it from South Africa, from India, from US, from UK, Canada. And you use that plan, okay, this plan is fine. You move ahead. Instead of the patient waiting until you're done, because you have a lot of patients too. So digital support, navigation, and then the best of the equipment for cancer care. Thank you.
Fantastic. So we know that patient support, digital navigation, and the ability to share digital radiotherapy are some of the ways. So Abiodun, please, I would like to ask you, can you highlight from us some other opportunities that you think still lie with your organization in actually supporting, some of these health technologies that can solve some of the health problems in low and middle income countries? What opportunities are present?
Okay, I'd like to say that opportunities abound, of course. ACT Foundation, we're just about 5 years old, and in our 5 years, because we focus on health, environment, entrepreneurship, and leadership. And even in all of these 4 focal areas, health takes a huge chunk of, the kind of granting that we do. I guess the audience knows that ACT Foundation is a grant-making organization, and we work with the likes of Shebekli, Cancer Care, and other non-profits in Nigeria, across Africa, who are actually solving problems for the vulnerable. And even in health, cancer care, maternal health care is also like in the front burner for us. And for us, what we do every year, we make our grant applications are available. So people just need to look out for the funding, apply for it, and then once they are reviewed, they get to work with us. In the past 5 years, thanks to the likes of Shebekli and some other cancer non-profits that we work with, we've been able to reach over 300,000 beneficiaries with information on cancer care. Over 30,000 have been screened. We've also been able to train health professionals, nurses, pharmacists, doctors, who have been able to help, with the navigation issue that Dr. Adeniji talked about, making sure that information is available, getting screening, providing navigation to treatment, and then providing other forms of support, of course, training and capacity building as well. And these are some of the huge barriers that we have. The issue of culture, people not knowing, that they could even do self-breast examination by themselves. And then if they find something, when you talk, we can then reduce late presentation issue and all of that. So at ACT Foundation, we're striving towards increasing, even the quota that we give to cancer care through partnership with other funders, that are available. So opportunities abound. There are international organizations who are willing to, to do this. World Health Organization, the likes of Bill and Melinda Gates Foundation. I was really happy to hear that, Roche is partnering with the federal government to reduce, to subsidize cancer care in Nigeria. By 80%, that's a lot. So people actually need to understand that the opportunities are here, and they just need to look out for the information. And, with such efforts, and with our efforts, and with some other donors also putting efforts into things like this, I believe that the opportunities abound, and it will only get better, and hopefully we'll get to close the gap in cancer care. Next call, okay, since you asked. So the last grant call is still going through review. We are at the final stage, and by the time the review is done, we get the results, and then we onboard our grantees for this set, and then the next grant comes up in October. So people would need to follow us on social media to
So please follow
see
ACT
that.
Foundation.
ACT Foundation _ on Instagram. Yeah, ACT Foundation on LinkedIn, Facebook, yes, and Twitter.
Fantastic. So all our innovators in the house, all our change agents, all our health solution providers, please reach out to ACT Foundation and get, that money to support, cancer treatment, to advance cancer care, to expand access and improve the patient experience. So I'll go straight to our poll once again. We've gotten some really amazing results. From what I can see, 75% of our audience have some basic knowledge of the topic and are interested, in understanding this topic more. So I think we'll just go over to the next poll, and then if there are any questions, we would like to take our questions now. Please just signify with a raise of the hand any questions, and we'll bring the mic to you. Questions from our audience? Okay, so I have, so fantastic. So I have my questions here on my Slido link. So I think I'll just ask the questions and any of our speakers can address the questions. So the first question I have here is, what are the plans to provide some of these cancer technologies to people living in remote areas without the access to internet-enabled devices? So I think Dr. Adenichi, since Mikio is working in that field, you can share with us some of the ways, innovative ways Mikio is reaching people.
Okay, thank you very much. The truth of the matter is, in the digital world, there are some things that cannot happen without super fast internet services. That is the truth. Without training, exposure, infrastructures. So in the remote area, number one is to ensure that we provide these things. We partner at, private level, private-public partnership to ensure that these things are provided. And then number two is to take these things to them directly as much as possible. For example, we can be talking about digital services for people in the remote area if they don't have internet, so we can as well take it to them physically. But the most important thing is to build something that they can learn from, and they can, that can stay with them, and they can take advantage of that. So we need resources to be able to do that. And I would like to end by saying this. When COVID-19 came, some African countries were helpless. For example, one of them was Togo. And, World Health Organization, UNICEF, they had to help them to have what is called the e-vaccine kind of arrangement. And then they have this Togo Voyage passport. So they supported them, and that's what they're still benefiting from today. And what was built, in 2019 has really helped them it has become like a stepping ground for their e-commerce activities and other digital activities. Thank you.
Thank you. So this is a global call for collaborations to support resources. We need to build structures. We need to leverage some of these resources. Now, speaking of resources, I have a question here which asks is that why is there such a limited resources of cancer resources? For one is, why is there a limited number of oncologists in Africa? So, Dr. Salako, can you share with us what are some of the reasons that may actually be behind this? Our audience want to know.
Okay. Why are there few clinical oncologists in Nigeria? It's multi-layered. There are several reasons. First of all, there are few universities that have the capacity to train students on radiotherapy. So in Nigeria, there are about 10 states that have radiotherapy machines, and it is where these radiotherapy machines are. That's where you can be trained after medical school for another 6 years to become a radiation oncologist. So the training centers right now are in Lagos, Luth, Ibadan, University College Hospital, Enugu. There are very few. So if you are a medical student training, let's say in I don't know, a state that doesn't have a radiotherapy machine, there's no way you'll be trained. You will not be exposed. You won't even understand what it means to, you won't have an idea that there's a career path called radiation oncology. So intrinsically, the training is just not there for many university programs. Secondly, oncology in Nigeria is sad. That's what people say. They say it's sad because a lot of patients die. And the reason why they die is also multidimensional. Many patients will have breast lumps and they will hide. Many women will not go for their cervical cancer screening, a cancer that is preventable. So a lot of patients present with stage 3, stage 4 disease, and many doctors don't want to spend 40 years of their career, taking care of patients that will likely die. And that's a personal, professional choice. There's so many other reasons. You also know that even with the current doctor, nurses that we have that is short, many people are jackpine. So we have a double dilemma.
We have the brain drain.
Yeah, the brain drain, as in so what can we do about it? It's one of the things we are doing at the Hub. We're saying, yes, you can be exposed to oncology as a clinician, become an oncologist, but you can also be exposed to oncology as an innovator, as an entrepreneur, as a researcher, as a scientist. We don't have to go the traditional route, in the 21st century, that you must be a consultant before you thrive in an oncology career.
Right, thank you so much. So I think this next question I will give to Dr. Matthew, and the question asks is, Dr. Matthew, what challenges have you encountered in implementing technology to meet the needs of cancer care in Nigeria? Can you share with us what the patient adoption rate looks like when it comes to innovation?
Yeah, certainly. So I guess the first part of that is quite a big question. There's lots of factors, I guess, in terms of implementation, and even thinking about Malola and the role of research, implementation science, and there's a whole research field there that really needs to be explored in digital health and cancer care. But just some things that I've experienced personally. So there aren't really care models that are well established for having digital health as part of cancer care. So that's kind of an emerging area. And I guess a way of kind of circumventing that at the moment is kind of adapting digital technologies for the context. So I'm thinking about like maybe in the refugee settlement, we had quite specific outcomes data we were collecting, but hepatitis B, TB are really highly prevalent in the camps. So we were able to kind of adapt what information was collected through the intervention to assist the clinical teams as well, to kind of want that data. But in the context of palliative cancer care, you've got a big problem is you've got really, really complex symptoms. So you might be doing remote monitoring and collection of data, but there are aspects such as, for example, distress that is really, really problematic. And levels of distress can be really high in patients with advanced cancer, but there aren't, well-developed screening tools to kind of capture that information. So for palliative cancer care, there are kind of complex symptoms that we still need to understand how best to capture. And the other angle as well, I guess, is kind of economic framing and benefits derived from digital health. Where people with advanced cancer often have limited or no social protection systems to provide any sort of safety net from financial toxicity. And often that means they need to pursue coping strategies that are not sustainable or can increase risks of things like bankruptcy, for example. And those risks or those costs don't necessarily fall on the health system. So we need to work on kind of developing really compelling economic arguments that will encourage investment in palliative cancer care broadly, as well as kind of how digital technologies can feed into that. And I guess it's kind of protect patients and caregivers, but building a wider economic argument around that. So that's kind of some of the implementation challenges I've experienced.
All right, thank you so much. So we need financial support. We need funding to support people with cancer, and we're calling on ACT Foundation to support many of these innovative technologies that are solving the cancer challenge. Thank you, audience, for your amazing questions. I mean, there are so many questions here, but we can only take this amount. We will quickly close up, and I just want to get in 1 minute, what key takeaway from this session do you want to leave our audience with? And I'd like to start with you, Dr. Salako. Please, one key takeaway.
So I would say we should all take our health very seriously. We should book our medical checkup, especially for ladies. Certain cancers are preventable, like cervical cancer, and technology is changing the way we screen. And one of the products we have now at Shebekli is the HPV DNA self-sampling kits. So gone are the days where you have to come to the hospital and open up to a doctor. With this kit, you can test yourself in less than a minute. As in, once you purchase it, you go into the bathroom and you just it's a tiny stick in there. You take it into you just use it to swab your private part. Inside your private part, all of the instructions are there. You put it back in the bag, and then you send it to us, or we collect it from you. And you get your test results in about 2 weeks. And it says whether the virus which causes cervical cancer is there or not. So my take-home message is, book your medical checkup, whether you're a man or a woman, and especially women. Cervical cancer is preventable. It's caused by a virus. There's a self-sampling kit that tells you if you're positive or negative. And if we find that you're positive, we can treat it and prevent cervical cancer from ever occurring. Thank you.
Fantastic. So, Abiodun, can you share with us a key takeaway? Oh, yes. My audience are really impressed with that technology. I mean, it's very, very insightful to know that in less than a minute, a woman can know whether they have cervical cancer or no. So that's really next level technology, and that's really what some of the last mile cancer technologies we're talking about here today. Thank you so much. So Abiodun, can you share with us one key takeaway that you want the audience to go home with today?
Okay, so I'm hoping that in the audience we'll have leaders and cancer activists, people who are actually fighting for people who are patients of cancer. I want to say that we should not work in silos. I'm always very big on collaboration. Let's look out for other people who are doing great things, people who have strengths in the areas where we have weaknesses, for example, and let's work together so that together we can actually make bigger efforts and really start our journey to closing the gap.
Right.
Thank you.
Collaboration for growth, collaboration for success. We can make so much impact by collaborating. Dr. Deniji, one key takeaway so we can.
Thank you. So quickly, I would like to say this. When it comes to information on cancer, I want this to be the takeaway from me. Let us try as much as possible. I know a lot of people try to know about cancer. We need to verify the information. I see a lot of people who come in with wrong information, and they've been with that information for a while. So cancer, this one can cause cancer, this one can cure cancer, and many of those things are not true. So let's verify information on cancer from the right sources. In as much as we are going digitally on social media, everywhere to get information, let's get the right information from the right sources. Thank you very much.
Thank you so much. And Dr. Matthew, one key message to leave the audience so that we can close out the session.
Yeah, sure. I guess for me, in terms of just real health focus cancer care, I think it's just not enough to ask people with cancer for their data. So I think patients and caregivers need to be central to digital health development. I think interventions need to meet their needs. It can't just be about gathering data. So I think crucial next steps would be developing platforms that can really engage patients and their caregivers, such as generating personalised guidance and feedback on how to manage symptoms or include resources that are really interested and useful to patients and their caregivers. So, yeah, I think that's mine. We just need to ensure patients' caregiver involvement is a central component of any current or future digital health development.
Okay, so the role of patients and caregivers in the cancer care continuum. Thank you so much, Dr. Matthew. Thank you all of you for staying with us to the end of this session. I mean, it has been insightful, it has been practical, and most importantly, it has been data-driven. We have another poll for you. Please share with us what emoji best describes your feeling at the end of this session so that we know how much we've impacted you. From my end, I would like to say one key session will be if you're dealing with cancer, if you know anyone affected by cancer, if you have a loved one or you just know anyone, please download the Oncopady Cancer app. You can visit us at www.oncopady.com, and we can connect you immediately to the cancer resources, connect you to resources, connect you to tools, connect you to support services, connect you to coping centers and clinics that can help you, support you with your care. And if you're looking to work with us, or if you're interested in supporting the work we do at Oncopady Technologies Limited, please feel free to meet with my team members at the back, or feel free to speak with me at the end of this session. Thank you so much for your time, and have a wonderful day. Thank you. Have a group picture.